Bismillahirrahmanirrahim. I am Professor Dr. Shahzad. Today we are going to discuss glycogen storage diseases. It is a group of inherited deficiencies of enzymes of glycogen metabolism in both liver and muscle. It is a generic term to describe a group of inherited disorders which are characterized by deposition of abnormal type or quantity of glycogen in tissues, or it is due to failure to metabolize glycogen. Glycogen storage diseases are divided into two primary categories on the basis of the organ involved. If the involvement is of liver, then it is presented with hepatomegaly, hypoglycemia or cirrhosis of liver. And if the muscles glycogen is involved, then it is presented with skeletal and cardiac myopathies or energy impairment. Glycogen storage disease type 0 is due to glycogen synthase enzyme deficiency. This glycogen synthase is the main regulatory enzyme of glycogen biosynthesis from glucose. The clinical features includes hypoglycemia and hyperketonemia, and the early death may occur in these patients. Von Gehrig's disease, which is the most common glycogen storage disease, referred to as type 1. It arises from a deficiency of liver or intestinal mucosa and kidney glucose 6-phosphatase, means the deficiency of enzyme glucose 6-phosphatase in liver, intestine and kidney. The patient with this disease may lack the glucose 6-phosphate itself, then it is called type 1A, or the glucose 6-phosphate transporter, then it is called type 1B. This type 1A, as I have already told you, is due to deficiency of glucose 6-phosphatase. The clinical features includes the accumulation of glycogen in liver and renal tubules, hypoglycemia, which is mainly fasting hypoglycemia and is the consequence of this enzyme glucose 6-phosphatase deficiency, although some glucose may release by the action of glycogen debranching enzyme. Lactic acidemia, because liver cannot use lactate effectively for gluconeogenesis and it produces lactic acid in response to glucagon inappropriately. Hyperuricemia may result from increased purine degradation in the liver. Ketosis and hyperlipemia may result from the increased availability of lactic acid for lipogenesis and lipid mobilization from the adipose tissue caused by the high catecholamine level in response to the hypoglycemia. Type 1B is due to deficiency of endoplasmic reticulum glucose 6-phosphate transporter. This is due to deficiency of transporter type 1B, and type 1A was due to deficiency of glucose 6-phosphatase. This type 1B Von Gehrig disease have all the clinical features as we discussed in type 1A including glycogen, including hypoglycemia, lactic acidemia, ketosis, hyperlipemia, and the accumulation of glycogen in liver and renal tubules. Along with, in type 1b, there is neutropenia and impaired neutrophil functions which lead to the recurrent infection. Patient in type 1b gives history of repeated or the recurrent infections. Pompe's disease, which is glycogen storage type 2 disease, is due to deficiency of lysosomal alpha 1,4 and alpha 1,6 glucosidase, also called acid maltase deficiency. And the clinical features include accumulation of glycogen in lysosomes. This may be juvenile onset variant and it has adult onset variants. Juvenile onset variants have muscle hypotonia, and patients may die due to heart failure by the age of 2 years. And in case of adult onset variant, patient is presented with muscle dystrophy. Cory's disease or type 3A disease, also called lipodextrinosis, is due to deficiency of the liver and muscle debranching enzyme. Patient presented with fasting hypoglycemia and hepatomegaly in infancy, and there is accumulation of characteristic branched polysaccharides called lipodextrin, and there is muscle weakness in these patients. Then type 3B, in previous slide we discussed type 3A, and in type 3B, which is also called lipodextrinosis, enzyme deficient is liver debranching enzyme. And the clinical features includes fasting hypoglycemia and hepatomegaly in infancy, and the accumulation of characteristics branched polysaccharides called lipodextrin. But in comparison to the type 3A, there is no muscle weakness. In type 3A, there was muscle weakness. Then type glycogen storage disease type 4, amylopectinosis or Andersen disease. This is due to deficiency of branching enzyme, and the clinical features include hepatosplenomegaly, liver and spleen both enlarged. There is accumulation of polysaccharides with few branch points. In these patients, death may occur before the age of 5 years, due to heart failure or liver failure, cardiac failure or hepatic failure. McArdle syndrome or type 5 glycogen storage disease, also called Myophosphorylase deficiency. The enzymatic deficiency is the muscle phosphorylase. The clinical features includes poor tolerance to the exercise, and muscle glycogen showed abnormally high level, that is 2.5% to 4%, and blood lactate may be very low after exercise. In Her's disease, which is type 6 glycogen storage disease, liver phosphorylase is the enzyme which is deficient in this disease, and hepatomegaly and accumulation of glycogen in liver and mild hypoglycemia is the clinical features of Her's disease, which is type 6 glycogen storage disease, and generally this disease has good prognosis. Type 8 glycogen storage disease have enzyme liver phosphorylase kinase deficiency. We discuss this enzyme in regulation of glycogen breakdown, and the clinical features includes hepatomegaly due to accumulation of glycogen in liver. There is mild hypoglycemia, and generally again this disease has good. Glycogen storage disease type 9 is due to deficiency of liver and muscle phosphorylase kinase enzyme. We discussed in detail this phosphorylase kinase enzyme during regulation of glycogen breakdown. The clinical features include hepatomegaly, that is the enlargement of liver, and accumulation of glycogen in liver and muscle, and there is mild hypoglycemia. Generally, this disease has good prognosis. Type 10 glycogen storage disease is due to deficiency of cyclic AMP dependent protein kinase A. We have discussed role of this cyclic AMP dependent protein kinase A in details in the regulation of glycogen metabolism. The clinical features include hepatomegaly, that is the enlargement of liver, and accumulation of glycogen in liver. This all was about glycogen storage disease. Thank you very much, dear students. Allah Hafiz.